Look, one of the best things about this show is that we get emails from you, our TV audience, about who you want us to interview. And we've been able to interview everyone from Steve Forbes to Steve Jobs in the past,
and
to
other guys not named
to
Steve.
The celebrities and purveyors of alcohol and the occasional drink recipe. But one thing we do is talk to CEOs of publicly traded companies every once in a while. This company called Novo Integrated, we got a lot of email from folks asking us if we would interview Rob Mattacchione. Rob Mattacchione. I'm going to say Rob Mattacchione.
Well, that's why you're hosting.
He's a CEO and board chairman.
Yeah.
But anyway, we're talking about the need for decentralized healthcare, and of course we're showing you their website for a radio audience. Just go to novointegrated.com. But Rob, great to talk to you. Did I say that correctly, sir? I hope I did. Mattacchione, right?
No, Sully, you did a great job. My name is there to challenge, and
yes, it is. That's yeah. You got a lot of doubles. You're like Mississippi.
Yeah, exactly.
yeah. Comes with being Italian, right?
It's Rob. Can I buy a vowel, Mattacchione?
Yeah.
Rob, great to have you on the show. Can you talk about the need for decentralized healthcare? Let's talk about the subject first.
Decentralized healthcare.
Yeah, and then let's talk about your company, because this is so interesting. And doing diligence on your company, it's really interesting. Your point of view.
Yeah.
Take the floor and tell us about that.
Thank you, guys. We come from the perspective that we're very traditional in nature. Our business was one that was founded in a treatment-based protocol where we deal with people on a daily basis. And what we found is that the system is flawed. And it's flawed in the sense that it hasn't progressed with technology. We required a centralized healthcare system in the past. Technology wasn't there to allow what was started as healthcare to patient, and it became patient to healthcare. So if we go back to the days of Little House on the Prairie, so to speak, we can see where doctors paid a visit to your home. That evolved into something quite different, and it created this asymmetric flow or ecosystem with regards to health, where the patient now went to the care. And by nature, it's really flawed. It's the only thing that we do outside of, a couple of other areas of life. Otherwise, everything's designed around comfort. We shop with comfort. We travel with comfort. We do all these things, but we do not engage in healthcare with comfort. And so we took the approach that we can use technology and embrace technology to create a quasi-decentralized atmosphere. Well, we're not suggesting that everything be home-based, but we do believe that home is important, and healthcare starts there. And we distinguish healthcare from health repair. And that's really why we believe that the decentralized approach to medicine is absolutely essential for the longevity of affordable medicine, because the gap will just continue to widen, both from an access perspective and who can actually receive the necessary services that we look to as a human species.
Now, I like the doctor coming to the house, because first of all, you're sick, you shouldn't leave your house. I mean, is that part of the problem, just leaving in the first place?
I know, Rob, you brought up something though, and that's we do everything in comfort from if we desire, from the comfort of our homes, or if we desire online, everything else.
Movies.
What's the answer? Is there an actionable answer that we can actually get to in any time soon?
Yeah, I think there is. I think we're living it. I think the pandemic has accelerated the solution. Virtual medicine, telemedicine, all these technological protocols that at one time were frowned upon by both patients and the health practitioners are now embraced. From our own clinical practices on physio, we've conducted virtual physio sessions for the first time in the last year at a scale that's never been seen before. So there is the solutions. They exist. They're there. We just have to embrace them. And for the first time, because of the pandemic, we're seeing both sides of the health spectrum embracing them. And that's, I mean, we need that. Otherwise, we can't progress forward as a society.
His name is Rob Mattacchione. He is CEO and board chairman of Novo Integrated. They are publicly traded under the stock symbol NVOS. Their website, novointegrated.com. Rob, talk to us about what you guys do, because you have not only product solutions, but you have medical technology, and talk about the entire company and give us sort of an overview on how you are helping this need for decentralized healthcare.
Well, we're a clinic-based organization, one facet of our business. So we engage in services across roughly 150 plus clinics. We also have an elder care division that pays attention to the most costly area of healthcare, and that's the seniors. And we integrate within those environments to provide service by way of technology in terms of lasers and things like that, as I touched upon with telemedicine as well. And we also try to create an emphasis to healthcare as opposed to health repair, in that products become very, very important. Supplements, medicines, progressive medicines, agricultural-based medicines, very, very healthy lifestyle thoughts behind product and product solutions. And so as we now migrate into a more robust platform, we look for micro centers. We believe that the facilities don't have to be super huge. They can be in any population center. Doesn't need to be in major metropolises. Can be in population towns that have 5,000 people, and we can bring medicine there. And that's really what we're about. We're expanding with some rather significant corporate partners into that mindset, and we're looking forward to the entry into the U.S. marketplace in a big way over the next little while. Presently, we operate almost exclusively in Canada, which turns out to be a very interesting beta center for us in terms of testing some of our notions and ideas. And so, that's the heart and soul of what and who we are.
And the examination room now is pretty much on your wrist with all the information, your little
technology's got to be helping your efforts specifically.
You can't steal those rubber gloves anymore, but the examination room is right here.
No, but the point is, you do have technology at your fingertips now. That's got to help this microsite sort of philosophy, right?
Yeah, absolutely. So technology is key, and to Russ's point, you can carry it on you. So one of our big attributes is remote patient monitoring, and that's really what the iWatch is about. But moreover, what we really have to embrace is the analysis of data, and that's what it gives us. It gives us an opportunity to apply AI, where we can streamline healthcare so that we can react to what's actually happening, not what we think is happening. And those technologies, those remote patient monitoring features, watches, and all kinds of other goodies are really what the foundation of tomorrow's medicine is about.
I can look at my watch and have it go, "Are you climbing stairs?"
No, you're
chasing a balloon.
Hey, listen, Rob, I want to have you back. Rob Mattacchione is his name. Really interesting stuff. I don't think we've ever had anybody actually talk about decentralized healthcare. Once again, he is the CEO and board chairman of a company called Novo Integrated. They are publicly traded under the stock symbol NVOS. That's N as in Nancy, V as in Victor, Oscar San, NVOS. And you can go to novointegrated.com. We're definitely going to have you back, my friend. I appreciate you coming on with us, and it's really an interesting sort of play.